I'm now going to talk through a Mayo type repair. The Mayo repair is a suture technique, sometimes referred to as vest over pants, or I guess pants over vest depending upon your fashion sense, which amongst other things is used to repair small hernia defects with sutures. On the simulator I've created two flaps, which is for illustration purposes only really. It's not what you'd find in reality. Normally you would just have a defect which needs to be closed. But the flaps which I've created allow the actual technique of the suturing to be demonstrated clearly. I'm going to refer to the near side, which is the flap at the bottom of the screen as you look at it, and the far side, which is the flap at the top of the screen. And I'm going to talk through two separate repetitions of the suture, one on the right and then one on the left. So we're going to start suturing on the right of the screen as you look at it. The first stitch we take is on the near side, and we're going from outside to inside. Remember to go in perpendicular through the fascia, coming out in the middle of the defect. And then rather than doing the natural thing, which would be going from in to out, we actually go to the far side flap, and again we go from out to in on this flap as well. So once you've done the first half of this stitch, it does look a little bit of a mess. Try not to get yourself tangled up as I'm managing to there. So then we stay on the far side and we're going alongside the previous suture from in to out. So you're back on the outside of the far side. I do these beside each other at the same level. And then we go back to the near side and we go from in to out on the near side, so that the needle and the loose end of the suture material are both coming out from the in to the out on the near side. And then leave enough suture length to tie a knot and put it on a clip and cut. So we'll talk through that again. We're going to do a second suture just on the left of the screen. We go from out to in on the near side. Get a decent amount of fascia, so not too close to the edge. You want some substance, but at the same time, if you get too much fascia, you end up closing this under tension. That is also a bad thing. And then rather than going from in to out on the far side, you go from out to in again. Unhook my drain, whoopsie. And then we go from in to out on the far side. And then we cross over the defect again and we go from in to out on the near side. Again, coming out alongside the trailing end of the suture. And again, leave enough length to tie and put on a clip. Two sutures is not a huge amount. Normally there'd be more than two, but for demonstration purposes I've just done the two rather than going through the same thing over and over again. On the model, if you've got one, you can do as many as you like. So then we're going to tie these. I'm using a clip to help tie and doing a hand tie to get some tactile feedback. So you can see as you tie, that brings the far side underneath the near side. So that's the vest going over the pants, or the pants coming under the vest, or the other way around, if you're very cool. Depending on the suture material, throw as many throws as you need to for that suture material and then cut. And then you do the same with the second suture. Again, bringing the far side under the near side in that vest over pants. And tie these and cut. And that's the Mayo repair. Now, as an augmentation to this, what I'll often do if the fascia is thick and decent quality, I'll then do a running stitch from one end of the repair to the other, just taking a bite of fascia from the top or from the near side and the far side. And this is just to tie it at one end to secure it, and then do a continuous running stitch, and that just doubles up on the repair and snugs the near side down onto the far side, which I think is a nice finishing touch for the repair. So if we've secured that, cut the trailing end, and then with someone following you, just do a over and over running stitch, continuous stitch from near to far. And this stitch can be locked as well. You can see I'm going through the loop there, so each throw I'm locking it to keep the tension on. If you've got someone following you, you don't need to lock it, but again, it's I quite like the security of locking these continuous stitches. So as I've said, normally more than 2 stitches for a full Mayo repair. 4 or 5 maybe. It depends on the size of the defect really. You don't want to crowd the defect, but I would be reluctant to rely just on 2 sutures. The teaching is that when defects are less than 2 centimeters, they can be repaired primarily with sutures. When the defects are larger than 2 centimeters, then we should think about using a mesh. I don't stick to the rule 100%. Sometimes when defects are a little bit bigger than 2 centimeters, but the tissues are good and I don't want to put a mesh in, then I'll do a suture repair. And if I can safely do a Mayo repair, then this is how I'd repair those defects. So running stitches come to the end, and we just do a tie at the end. This is a braided suture, so at least 3 throws. I'll probably do 4. Try not to stab myself with a needle in doing so. And cut, and that is the end of the Mayo repair. So out to in, into out, and tie.